Stroke signs and symptoms. Would you like to take control of your health and reduce your risk of stroke? It's important to know the signs of a stroke and get medical attention right away. In this video, we'll provide you with easy-to-follow tips that can make a big difference. By making small changes to your lifestyle, you can significantly lower your risk of stroke and stay healthy. A blocked blood flow to a specific part of the brain causes a stroke, a critical medical condition. Brain cells require oxygen and nutrients to function properly. A stroke deprives brain cells of these vital resources, causing them to begin to die. Depending on the affected part of the brain, the symptoms of a stroke can appear suddenly and vary. The following are some of the most common symptoms to look out for. You might be having a stroke if you have trouble seeing with one or both eyes. This sign is caused by a blockage in the blood flow to the parts of the brain that control vision. When someone has a stroke, it can affect the pathways that help them see, causing several vision problems. Some of the vision problems that can happen after a stroke are: lost sight all of a sudden in one or both eyes, trouble seeing or seeing twice, darkened eyesight or blackened areas in the field of vision. When you have visual field loss, you can't see everything in your field of vision. These symptoms can occur if the arteries supplying blood to the eyes or the brain regions responsible for vision become blocked. For instance, blockage of the ophthalmic artery or its branch, the retinal artery, can result in complete vision loss in one eye. If your vision changes quickly, you should pay attention because it could mean you're having a stroke or another dangerous medical problem. If you or someone else suddenly has trouble seeing, you should see a doctor right away. Remember that getting treatment right away is very important for getting the best result after a stroke. People who have had a stroke often feel rapid numbness or weakness in their face, arm, or leg, especially on one side of their body. This sign could indicate insufficient oxygen and food reaching the brain, typically due to a blocked or burst blood vessel. A stroke can affect any part of the brain, and the signs a person experiences vary depending on the affected part. There are two halves of the brain, and each half handles the other half of the body. In other words, a stroke on the left side of the brain will affect the right side of the body, and the same is true the other way around. A sudden sensation of numbness or weakness can manifest as not being able to move the face, arm, or leg that is hurt. A heavy feeling or numbness in the limbs that are affected. When someone tries to smile or speak, you can see that one side of their face is droopy or can't move. It's very important to notice these signs and act quickly. You need to see a doctor right away to reduce brain damage and possible long-term effects. Always keep in mind that strokes are medical emergencies and that every minute counts. Don't forget to hit the like button and subscribe to our channel so you never miss out on our new informative videos. Having trouble walking, feeling dizzy, losing your balance, or not being able to coordinate your movements are all known signs of a stroke. Problems in the parts of the brain that affect our balance and movement usually cause these symptoms to appear quickly. A cut-off or slowed down blood flow to a part of the brain prevents brain cells from receiving oxygen and nutrients. This is called a stroke. Depending on the affected part of the brain, this can lead to the death of brain cells and alter the body's functioning in various ways. Damage to the cerebellum and brainstem can occur during a stroke. These parts of the brain are very important for movement and balance. Breaking into these areas can lead to: if you have ataxia, your muscles may not work together properly, which can make it hard to walk and make you stumble or fall over. When you have vertigo or are dizzy, you may feel like you or the room is spinning. Indeed, signs of a stroke include confusion, difficulty speaking, and difficulty understanding what others are saying. These signs show up after a stroke because it can hurt the parts of the brain that control words and thinking. A stroke slows down or stops blood flow to the brain. Damage to different parts of the brain can lead to different symptoms. For instance, the left hemisphere of the brain often links language and words. As a result, a stroke in this area could lead to aphasia, a disease that makes it hard to communicate clearly. It is important to take a sudden and severe headache seriously, as it could be a symptom of a stroke or other serious medical conditions. People frequently describe a stroke-related headache as the worst headache they've ever experienced. The pain is intense and comes on rapidly, usually within seconds or minutes. The location of the headache pain varies depending on where the stroke is happening. For example, a stroke affecting the carotid artery, a major neck artery that supplies blood to the brain, can cause a headache in the forehead, whereas a stroke affecting the vertebrobasilar system, which supplies blood to the back of the brain, can cause a headache at the back of the head. Migraine headaches can also be severe but have different patterns and may include other symptoms such as sensitivity to light and nausea. In contrast, a stroke headache is more sudden and intense, often without the typical migraine features. Other serious medical conditions can also cause extremely painful headaches, including hemorrhagic, bleeding, stroke, which occurs when a blood vessel in the brain ruptures and bleeds, and transient ischemic attack, TIA, also known as a mini-stroke, which has less severe symptoms but still requires urgent attention. TIAs can serve as a warning sign for a full stroke. The following advice can help you prevent a stroke. Keep your diet in check by selecting nutritious meals and snacks. Consuming an abundance of fruits, vegetables, and whole grains is required. Reduce your intake of cholesterol and harmful fats, including trans and saturated fats. Cut back on salt if you want your blood pressure to drop. To avoid strokes, exercise. Regular exercise, every week. Try to get in at least 150 minutes of moderate-intense or 75 minutes of vigorous-intense aerobic exercise. You can also divide this into manageable activities that you spread out throughout the day. Control your weight. Obesity or being overweight raises your risk of stroke. If you must reduce weight, do so healthily and progressively. Give up smoking. One of the main risk factors for stroke is smoking. One of the finest things you can do for your health if you smoke is to give it up. Limit your alcohol intake. Drinking too much alcohol might raise your blood pressure and stroke risk. Maintain blood pressure control. High blood pressure is one of the main risk factors for stroke. Handle additional medical conditions. To lower your risk of stroke, it's critical to address any diabetes or high cholesterol. Make an appointment for routine medical examinations with your physician to track your blood pressure, cholesterol, and glucose levels. Making these lifestyle adjustments can dramatically lower your risk of stroke. If you found this video helpful and would like to see more health tips, please like, share, and subscribe. If you have any comments, feel free to leave them below. Thank you, and see you in the next video.